Hello everyone, Sastrikal Saryanu, Namaste, welcome all on Achievers. Today we're going to talk about carotid endarterectomy. So this is clear from the name. What is carotid? So this is the main artery in our neck that taking oxygen blood supply to our brain. When this is affected, it's going to decrease oxygen and blood supply to our brain and the patient is risk of stroke. The strokes are two types, ischemic stroke and hemorrhagic stroke. What is ischemic stroke? Ischemic stroke is when there is a less blood supply to the brain and oxygen supply to the brain. Patient is feeling like dizzy and altered level of consciousness and the patient is at the risk of stroke, and that is ischemic stroke. It can affect one side of the body side. And hemorrhagic shock, this is same thing, stroke, but this is the different scenario in this one. Any artery or vein get pop up and any injury to the brain start causing bleeding inside our skull, inside the brain. So the patient on the risk of stroke. So the most important question in this topic in the NCLEX is, here you go. So the risk after the surgery. Now patient still on the risk of shock, but shock बदल गया है. कौन सा stroke है? Now is hemorrhagic shock. So क्या हो सकता है? After surgery, patient के brain में risk है bleeding होने का. Why? Due to sudden increase in the blood flow. जब all of sudden blood flow increase होगा brain में, क्या होगा? Arteries and veins, they are on risk of increased blood flow in the brain. उसकी वजह से वो artery और vein pop up हो सकती है and blood hemorrhagic shock हो सकता है brain में. So still patient on the risk of shock. So उसमें आपको पूछेंगे priority of the nurse. They love to ask difficult question in the NCLEX, especially in the next generation. So next generation is based on clinical, mostly clinical experience things. So according to my clinical experience, I can tell you this is very important because I work at STEMI and stroke center. So every day we handle over there cardiac arrest and code neuro. So this is our daily life. So this is very important thing. Okay. सर्जरी हो गई, पेशेंट पहले स्ट्रोक के रिस्क पे था, इस्कीमिक स्ट्रोक, एंड देन आफ्टर सर्जरी द पेशेंट इज एट द रिस्क ऑफ हेमोरेजिक शॉक. सो उस हेमोरेजिक शॉक को हम कैसे मॉनिटर करेंगे? इफ दे आस्क यू, इफ द पेशेंट इज अनकॉन्शियस, पेशेंट कॉन्शियस नहीं है, मे बी द रीजन ऑफ एनेस्थीसिया. सो उसमें कैसे मॉनिटर करेंगे कि नर्स को कैसे पता चलेगा कि पेशेंट को स्ट्रोक हो गया है, राइट? फास्ट. Always remember this thing. This is very important. So the first thing in the patient, if the patient is unconscious and unresponsive because of anesthesia or any other reason, facial drop. The unsymmetrical difference in the patient face, right or either left side, any drop of the facial lining, any drop of the eyebrow or eyelid, that means patient going into the shock, into the stroke. So this is the very first important thing to monitor in the unconscious patient. If the patient is conscious, we can go for these three things like arm weakness. If the one side of arm is weak, any drifting or something, hold for 10 seconds. If the arm fell down and not having the good strength like it used to be before, it means something is going on up there under the skull. So nurse have to follow up that. And speech difficulties, definitely. The patient going to the stroke, it affects to the speech. Their speech is hard to understand. They start muffling and they're trying to speak, but their brain is not finding up the correct word and the patient feeling difficulty when they communicate, right? And then nurse have to do what? Record the time when these symptoms start. Okay, go ahead one more time. Just overview. What is that carotid endarterectomy? Procedure to remove the plaque from the carotid artery from here because it's affecting the blood flow to the brain and patient can go to the stroke. Which stroke? Ischemic stroke. Okay, surgery हो गया. अब क्या है? Patient still on the risk of shock. Shock बदल गया. कौन सा stroke है? कौन सा shock है? Hemorrhagic. This is not done yet. So nurse have to more pay attention on the patient on the alertness in any mental health. How? कि क्यों होता है hemorrhagic shock? Why? So any sudden increase into the blood flow, artery or veins can pop up, right? It can cause bleeding. So nurse priority. This is the important thing over here. This is nurse priority to keep eye and keep watching sign and symptom of any alteration in the patient. If the patient is unconscious or either conscious, keep eye on the fast facial droop. हम अनकॉन्शियस पेशेंट में ये देखेंगे जिसकी वजह से हमें पता चल जाएगा द स्ट्रोक इज गोइंग ऑन, एनी ब्लीडिंग इज गोइंग ऑन अंडर द स्कल. So arm weakness, any drifting, speech difficulty, and make sure write down the time. So they can ask you this thing. So is it fun? So keep in touch with us, with Achievers. So we're gonna keep posting this kind of videos so you guys can learn with best examples. I'm gonna keep giving you example on my daily experiences, so you're gonna love to study. So please, if you have any question regarding any application process, any NCLEX questions, text us anytime. We are here 24/7, 365 days, only and only for you. Feel free to text on us, any WhatsApp number, like American number, any Canadian number, text us. So we are here for you, and we're gonna keep uploading this kind of videos. So please follow us on Insta or either on YouTube. And thank you so much for watching this video. Have a wonderful day. Bye.